This particular article actually talks about applying the syndemic framework to cancer research for possibly effective cancer control in low middle income countries. So the idea for this particular article actually emerged out of my discussions with my co-author, Dr. Zahid Bhatt, who is part of a research group at School of Public Health Sciences, University of Waterloo. And his group has actually been working on the syndemic framework to explore syndemics of infectious diseases and their clustering within specific populations for some time now. And they were interested in expanding the role of this framework in NCDs, specifically cancer. This is an area that has always interested me because I feel that for lower middle income countries like Pakistan, we need contextually relevant research that generates local evidence that is feasible and that can lead to, contextually relevant evidence-based healthcare planning and delivery. So we decided to, explore this idea further. And we looked at how this particular framework could be applied to cancer research, which is what we suggest in our work that we are about to publish with Cancer Medicine. We know that cancer burden is going to rise globally, and it's expected to reach some really high numbers in the next couple of decades. But the burden is expected to be really disproportionate for LMICs. And it is expected that LMICs are going to expect 400% rise in cancers in the next 50 years. And it's not just the rising burden of cancer, but also the disparity in outcomes in LMICs that is of real concern, because it is expected that by the year 2030, 70% of cancer deaths are going to be occurring in LMICs. And the reason for this is that there are several fold reasons. Firstly, the rising cancer burden, it actually pressurizes an already weak healthcare infrastructure that most LMICs have. Secondly, LMICs have poor social determinants of health, and which includes gender inequality and environmental factors and economic factors and political instability, and sometimes even peace-related conflicts in such countries, which make healthcare access really difficult and really problematic, which leads to poor health outcomes for many diseases, but especially for non-communicable diseases. The third point is that LMICs actually already also face a double burden of infectious diseases as well as NCDs. So you have a convergence of chronic infectious diseases and NCDs, including cancer, that definitely does not help outcomes, for these conditions. So it's important to not only understand the clustering of this illness, which is what the syndemic framework enables us to do. And syndemic framework actually helps us look at clustering of these diseases within specific populations and how the wider socioeconomic and environmental context within which they occur adversely affects the outcome of these conditions. And it also enables us to study how different diseases that are clustering within a certain population, how and if they interact adversely. And it is this interaction, the adverse interaction of various diseases in these populations and the wider impact of the socioeconomic and environmental context that is really important to study if we wish to have effective NCD and cancer control in such populations. And it's important to operationalize this, because currently, while it is an understood requirement that countries with high cancer burden need national cancer control programs, most of these national cancer control programs are based on evidence that is generated in high-income countries, which might not be relevant to low middle-income countries. And this is so because most of the research is being conducted in high-income countries. And this direct import of evidence that is generated in a different context to, the context of LMICs results in programs that are very focused on state-of-the-art diagnostic facilities and expansion of treatment facilities, which might not be the reality for most LMICs or might not even be possible. So that leads to programs that aren't really cognizant of the reality of the context of those countries. So this particular framework actually allows us to understand where, if possible, we could make interventions, both public health level interventions as well as community level interventions, which might lead to better prevention and an early diagnosis, hence reducing the burden on the existing healthcare infrastructure and possibly improving outcomes for cancers in such populations. And I've spent some time in this context, and I'll now answer your specific question about how to operationalize this particular framework. So the thing is that syndemic framework was introduced some 30 years back by Meryl Singer, a medical anthropologist, who actually described firstly the SAWA syndemic, which was related to substance abuse and violence and AIDS in a group of vulnerable population within USA. And he demonstrated how these particular social and medical conditions were not just merely coexisting, but also interacting adversely and leading to poor outcomes for these populations. Since then, the syndemic framework has actually been studied in many infectious diseases as well as non-infectious diseases and chronic non-communicable diseases. However, this particular framework, A, has not been explicitly studied for cancers. And B, if you look at syndemic research on NCDs, the reviews that exist and any meta-knowledge research that exists, it shows that for syndemic research on NCDs, it mostly focused on micro-level context. It often lacked the mixed method approach that is needed to really understand such frameworks. And also, there were challenges with conducting interdisciplinary research, which is really needed to operationalize this particular framework. So what we need is, studies that incorporate quantitative research with ethnography, constituted by multidisciplinary teams that includes not just biomedical researchers, but also behavioral scientists and anthropologists and public health scientists, and even racially and ethnically diverse researchers who have the experience of living in and working with communities that are affected by syndemics to really operationalize this particular framework for cancer research and to better understand cancer clustering for vulnerable population in LMICs and perhaps generate feasible cancer control solutions. I think a very crucial aspect of any LMIC researcher to be able to conduct this work is the availability of funding. And I think at the moment, most funding opportunities, while they do cover NCDs and cancer, I feel that given the importance of studying this framework for LMICs and the expected cancer burden in the coming years, it's crucial that international funders actually set aside a certain funding opportunity or a certain funding share specifically for studying the syndemic frameworks for cancer. Because if we want LMIC research leadership to really work on this, they would need to be supported in terms of having the means to conduct this kind of work.